The topic today is immunity and using wellness as a shield. This is part of the course, the Extending Healthspan, otherwise known as medical weight management. So the topics are going to be how to create a presentation and how to create a paper, how to write and put your things down using an outline. And to do that, I'm going to use the example as immunity and talking about the causes of death, determinants of immune function, and some of the clinical research. The benefits of a great outline are to organize your ideas, get them down on paper. And when you first have this big project, it looks like this massive task, and you go into analysis paralysis. But creating a great outline breaks it down into these smaller attainable subunits. And then in effect, it creates this nice fluid presentation. This is what the outline looks like for the book that we're creating in the class. The outline will be the subtitle, the introduction, prevalence, significance of the problem, definitions, history, examples, conclusion, recommendations, summary, and then the references. And it keeps it a nice fluid. When this is initially designed, however, you might start at one section and then another week work on another section, and then you just put it all together. But in essence, you don't start with your title and introduction first. As a matter of fact, all great authors leave the title for very last. This is a presentation of the immune system. Wellness is a shield. So a balanced life is the best defense. My title is Wellness as a Shield. My subtitle is A Balanced Life is the Best Defense. So you have an idea of what I'm going to talk about. In the introduction, wellness creates a balanced immune system. So I'm going to tell you what I'm going to talk about. Optimizing the 6 lifestyle choices: exercise, sleep, the chemicals that you ingest, whether prescribed medications or other chemicals in the environment, food timing, stress, and food types. And all of these optimized improve your ability to fight disease and extend your health span. Going on to the prevalence significance. Up until the 1960s, infectious disease was our primary cause of death in the United States. And this is a graph showing all these infectious diseases: influenza, pneumonia. This was the Spanish flu epidemic of 1918. And these are some of the other infectious diseases like polio, these other smallpox, these other infectious diseases. And this is an image of one of the hospitals in 1918 full of patients with the Spanish flu. And then with the advent of public health interventions, vaccines, all of this changed from the 1960s to be changing with the increased lifespan. Actually, people started dying of heart disease and cancer until COVID-19. Beginning then, COVID-19 during these spikes would compete with heart disease and cancer as the leading cause of death. And this is an image of an ICU with patients on ventilators. And this is, of course, the background image of the mobile morgues in New York City trying to manage all the corpses. According to the CDC data that looked over 1 million patients from January to May of 2020, they found that patients with coexisting conditions are far more likely to die. So if you had no coexisting disease conditions, your risk of death was 1.6% between January and May of 2020. And people with coexisting conditions were more likely to be hospitalized by up to 45%, and their risk of death went from 1.6 to nearly 20%. The coexisting conditions, this is an infographic that the CDC put out, that people that are at higher risk, these coexisting conditions included being older, having chronic lung disease because COVID-19 wants to go to the respiratory system, serious heart conditions, immunocompromised patients, cancer survivors, patients with diabetes, and patients with obesity all increase the risk of dying from COVID-19. So let's look at what's happened over time from the 1960s on. And a lot of that is the world. Actually, it's not just the US, but the world BMI. The body mass index has increased dramatically since 1960 to 220. So we're going to look at these root causes to look at how to treat a problem. This is a public health approach. So you look at the symptoms, which in this case are the increased rate of infectious disease, and look at these root causes of the problem. All right. So cause of death from COVID-19. First of all, what's causing the death? It's always with respiratory failure, or by and large, the biggest cause of death is respiratory failure. But there are two different mechanisms. A risk of death, say from a cancer survivor, patients that's on chronic immunosuppression will have a very slow or under-responsive immune system. Their immune system is fighting with just their white blood cells, but they're not producing antibodies very quickly, and the virus, in fact, overwhelms the lungs. And then on the other end of the spectrum is the overreactive immune system, which happens with obesity. This is a cytokine storm where the neutrophils granules kill the host tissue. Now these granules that are released by the primary white blood cells, neutrophils, they react in such an abundance that they release all these granules, and it's like releasing packets of bleach. It kills the pathogen, but it also kills that very fragile lung tissue. So some examples and evidence, and we're going to present studies that add credibility to the presentation. So an under-responsive immune system includes aging, overtraining, sleep deprivation, malnutrition, high cortisol levels that can happen with stress. And it can also happen with medications like prednisone, patients that are immunosuppressed that are being treated for some type of cancer, maybe on prednisone to reduce their immune system, or patients that have had a kidney transplant will be on immunosuppression so that their body doesn't reject the new kidney. An overreactive immune system is in the case of obesity. Let's go on to the scientific studies. These are some studies looking at lifestyle interventions as reducing the risk and balancing the immune system. This is a study that was, actually this is a compilation of multiple studies and a review article that look at multiple review studies that ask the question if intermittent fasting treats metabolic syndrome in humans. And the conclusions were that intermittent fasting treats metabolic syndrome. So metabolic syndrome is where they have increased insulin insensitivity, and patients will have type 2 diabetes. Intermittent fasting is shown to improve their insulin sensitivity, stimulate lipolysis, which means it stimulates fat breakdown, and it also reduces blood pressure. And by the way, this is it for those in the classroom. This article included all its list of references is in the Canvas file. Okay, a meta-analysis. This is a paper that takes many studies that are similar, and they compare their results. So you get more of a robust evaluation of the research question. The studies included 6 randomized controlled trials and 3 cross-sectional studies. And the results showed that fasting for 3 or more days had a greater than 30% decrease in blood insulin and glucose levels. It also found that there was a reduction in the insulin-like growth factor, IGF-1, and that's a chemical that accelerates aging and cancer. So the conclusions of that is that intermittent fasting may reduce the inflammatory conditions and also slow down aging. Okay, next topic, intensity of exercise on the immune system. This is a case example. He ran marathons, was fit. Why did he almost die of COVID-19? This is called overtraining syndrome. This is on the other end of the spectrum. This overtraining syndrome can be measured by taking blood and measuring the cortisol to testosterone ratio. With increasing cortisol, overtraining syndrome, you see a reduction in the immune function. So you're not generating your own antibodies to kill off pathogens. This research looked at 1,000 adults. They were followed for a 12-week period during the winter and fall, and they were monitored for upper respiratory infections. And their exercise amount and intensity was followed. What they found was this interesting J-shaped curve where people who exercised just moderately, greater than 5 days a week for about 30 minutes a day, had the lowest rate of infection, or those people that overtrained, didn't monitor themselves for overtraining, had a higher rate of infection. And that was compared to those that are on the couch potato side. So there is a sweet spot for how much exercise is good for the immune system. Now, overtraining causes high cortisol levels. And other causes of high cortisol are the chronic worry state, sleep deprivation, and the medications like prednisone, immunosuppressive medications. So prolonged cortisol causes systemic inflammation. You produce fewer antibodies and you develop a weakened immune system. So in conclusion, with these studies, what I'm talking about, we're going to tell you what I told you. We're going to summarize the evidence. I gave you a few examples of immunity boosters, and that is fasting, moderate exercise, stress reduction, and quality sleep. That a sluggish immune system comes from an overwhelming infection. You have too little of an immune response. Conditions are overtraining, aging, malnutrition, cancer, and sleep deficits. An overactive immune system, where it's unbalanced, is this deadly cytokine storm. So obesity is a state defined as BMIs over 30. You'll end up with a too much of an immune response. Immune system disruptors with the high cortisol, the examples we gave were overtraining, stress, and sleep deprivation. The immune system boosters included fasting, improves metabolic syndrome, and slows down aging. So the recommendations based on this evidence that I presented, the scientific evidence, I would recommend a fasting routine every day. It's very difficult to go, from eating up until 10 or 11 o'clock at night to fasting 16 hours a day. But it's not too bad to start with 10 hours a day and gradually increase. Go from moderate exercise, at least 30 minutes a day, 5 days a week. And then look at your other cortisol reducing strategies that include quality sleep and a stress reduction program. So a summary statement for the topic I've presented. Wellness creates a balanced immune system, and the total contributors for a balanced immune system include exercise, sleep, looking at the chemicals that you take in, the supplements, food timing, so intermittent fasting, stress, and the food types that may include some of the emulsifiers, highly processed foods. And this is the summary of creating a balanced immune system. Now, if you notice, I didn't specifically address obesity because, as we've talked about in earlier lectures, that ends up treating itself when all of these factors are taken into account. In the cases of very, very, very high BMI, that may be a role for bariatric surgery. And we'll get into that in actually the next lecture. Well, these are my references. And the summary for this presentation is an outline. Always use an outline when you're communicating more than one thought. So if you're creating a well thought out letter or email, create just a brief outline. And the outlines for the class where we're creating papers that we'll put into a book will be this exact outline so that they'll all flow together in a book. I showed the example of presenting, where when presenting on the slides, you want to avoid, having full sentences and using more words, more images than words. I talked about the health factors again and health creating a balanced immune system. So in summary, remember, tell the audience what you're going to say it, then tell them what you've said. Any questions, please leave comments and please subscribe. Thank you.